for me at least, is that most people after a stroke are heavily, heavily, heavily dependent on visual input. And that can be problematic on multiple levels. Pulling a shirt on over your head, washing your hair, those moments where you do close your eyes, it makes those situations a little bit more risky for someone who's had a stroke. The other thing that I think this study highlights is that we become, or someone who's had a stroke becomes visually dependent, but not in all cases did the stroke or the area of the brain that was damaged impact those somatosensory inputs and those proprioceptive inputs. And this is what I would call maybe like a learned non-use. So I do talk about a learned non-use phenomena that occurs after a stroke a lot when it comes to compensation and becoming really strong on your uninvolved side. It's just something that happens after a stroke that our brain adapts and reorganizes. And the more we allow those adaptations to kind of dominate our movement. So when it comes to movement, the more we just only use our uninvolved side, the brain actually reorganizes around that and starts to kind of devote more energy or attention to making those areas of the brain that weren't injured, make them be responsible for more functions in the brain. So the uninjured side of the brain actually starts to take over for some of the damaged areas of the brain. And I think this is probably a similar phenomena, that if you become just dependent on using your vision all the time, that it's kind of like those areas of your brain, somatosensation, proprioception, your vestibular system, they don't get as much work and they kind of become weaker. Now, here's one problem that I do see with this study is that the first group that had the intervention, someone was like actually holding their head.